Okay, initially I had a hip operation, and after the operation I was okay, but then I kind of did something, and I thought I kind of like injured myself, and I developed a pain in the side of my right thigh. It was like a sharp pain, like a stabbing type pain. So whenever I sat for a long time, or laid down in the bed, or upon rising up, I would feel like a sharp pain, like oh, like somebody, and I always look for that pain. In other words, it put a lot of pressure on me, and I wasn't able to do a lot of different things in terms of like activities. So I'm social, so I like to go out and hang out and do a little dancing, and I still try to go to the gym, stuff like that. So I'm a senior, so I'm trying to do those things.
I understand that this prevented you from dancing.
Oh yes, most definitely. And like I said, I'm a social type person, and I'm into a lot of outside activities. I like to dance and hang out with my contemporaries, and this has given me a lot of pain. And it took me a long time just to do regular things like put my pants on, or even now I could take a shower. I could take a shower like in a couple of minutes. Before I'd have to wait to go until the legs said I can go. I can only move when the legs said I can move. But now I'm able to just go for it, and I'm kind of shocked because this is about 5 weeks now since you gave me the treatment. And what's happening is I'm kind of still looking for the pain. I don't have the pain when I rise out of the chair, out of the bed, or out of the car. I don't have the pain. So it kind of like throws me off a little bit. I'm looking for the pain. I'm going like, oh, where's the pain? But it's not there. So I'm pretty happy with the results, and I've been telling everybody about you, man.
How fast did you feel improvement after the procedure?
Oh, I would say maybe within that day, the next day, I had a little swelling in that area, but it went down, and I felt better. Like I said, probably the next day, and prior to that, when I had the pain, I was taking like like meds for it. In other words, to kind of mask the pain, and I was taking it like twice a day, and sometimes it wasn't really working as well as And now I haven't taken it at all. I've taken since the procedure, so I'm pretty happy with it. And like I said, I'm able to go walk as far as I want to walk, and it gives me mobility, man. It's a good feeling.
You had a hip replacement.
Yes.
And then what were they thinking of doing if we were not going to be successful? What were they going to do?
Right.
To treat this?
Yeah, because what had happened when I had that was my second hip. Okay, I had the hip replacement in like in 2014 in October, like right around like Halloween, and I think I kind of like injured it again, like maybe like around December, January, January 2015, and then what happened? I developed a pain in the side of my right thigh, and it was always there. And I went to the doctors. They couldn't really, back to the surgeon, really couldn't find out what was wrong with it. I had plenty of X-rays. I had an MRI done. I had they aspirated because they said it had a lot of inflammation and stuff like that, but still had the pain. I'm saying like they were telling me they wanted to do it over, and I was like feeling kind of depressed about that because that's my second hip, and like come on, I don't really want to go through that and the rehab and just to build myself back up again because I live by myself, and I do a lot of things around my house, so that prevented me from doing a lot of things. It's simple things like putting on your socks or putting on your pants. It just now I feel a lot more relaxed.